forward our work around suicide prevention and the implementation and enhancements around 988. So you're going to hear from three folks today. First will be Dr. Perry Rosen, who has been absolutely instrumental in building Pennsylvania's suicide prevention plan. Several years ago, I think many of you might remember under the Wolf administration, we did some suicide roundtable / listening sessions across the Commonwealth. And she helped assist with those and pulled together the strategic plan around suicide prevention. So she's going to share with you where we are with that planning process. And then you will hear from Sarah Goulet. Sarah is a special advisor to Secretary Arkush here in the Department of Human Services. And Sarah has been working both with suicide prevention and our 988 work for several years now. Sarah's going to share with you a bit about some of our media efforts around advertising 988 and making sure that the word gets out about the use of that helpline. And then last but not least, you're going to hear from Dan Trago, who is a member of my staff that has been integral in helping lead us through the work that we're doing in terms of 988 call centers and data reporting and creating sustainable paths forward for those call centers. I also wanted to just make mention that I have a couple other staff members on the line during our Q&A session, particularly calling out Jill Stemple, who is our Policy Planning and Program Development Bureau Director, and Steve Ross, who has been leading a lot of our crisis related work and has been getting out to most of your counties at this point to have conversations about the crisis system more broadly. So they're on the line in case you have questions toward the end of the session. Without further ado, Dr. Rosen, I'll turn the floor over to you.
All right, thank you so much. And thanks to everybody that's here this afternoon on your lunch break. Just really appreciate your willingness to be here for this topic. And I'm also really looking forward to hearing from you once we are through the presentation about the things that are going on locally in your counties. So I want to start off just briefly by highlighting some of our data trends. This graph right here is showing the suicide rates, and we're comparing the United States. And it looks like the little red line key at the bottom, which would be Pennsylvania. The key is kind of missing, but the red is for Pennsylvania. So if you're looking back from 2011 all the way to 2022, with 2022 actually being our most recent year on record for suicide data that we have available to us at this time, you are seeing that those suicide rates were kind of hovering around the same area, kind of toward those earlier years. And then the suicide rates in Pennsylvania started to surpass the rates nationally. You're kind of seeing that red line more towards the middle of those years going up. And then interestingly dipped below national rates in 2020, which we all know as our pandemic year, one of the most significant pandemic years, of course. And that was an expected dip. That's something that we have seen at other times of large-scale crisis situations, but then has come back up. On a promising note, has not come back up past the national rate and has actually stayed steady those last 2 years at around 14 suicides per every 100,000. And we're hoping that that trend, either stays, and obviously we hope that it would continue to go down. But that's where we are right now. And I want to acknowledge that you all might have more current data available to you in your counties. If you're part of your local suicide prevention task forces, sometimes those task forces have the coroner participating, or you may have those relationships where some of our local task forces are actually getting data as current as like last month. So this is really just what we have when everything kind of comes through to the state level. And then of course that goes up to the national level. But it is a challenge just in general because, we know that we're looking at data from a few years behind at all times. And a lot of the work that I do, because I'm based in the Children's Bureau, is actually focused on youth. And I'll just kind of give a quick shout out. If you notice the background that I have today, that actually comes from a design from a high school student in Pennsylvania through an annual PSA contest that we do with our high school students. And I'll share a little bit more about that at the end. But really the work that youth do and the messaging that youth can have as far as how they are communicating with their peers about suicide is incredibly powerful. So we've tried to really share that out as widely as we can through some of these efforts. But here is what we have in Pennsylvania as far as what youth are reporting. And this comes from our Pennsylvania Youth Survey. So that's the PAYS survey, if you've heard of that. We actually have about 80% of schools in the state that are participating in the PAYS survey, and it gives a ton of wonderful information as far as all of the risk and protective factors that our students are facing. And communities can use this information, schools can use this information to plan prevention efforts. But of course, it does capture some data and feedback directly from youth, specifically about suicide and some of the risk factors like symptoms of depression, which you see there at the bottom. And a couple things to just point out. So if we're looking at these numbers, what our youth are telling us, and this survey is administered to students in grades 6, 8, 10, and 12. We're now going down to 4th grade, and it's every other year, as you can see. And so for our most recent year of record, 16% is 1 in 6 of our students in those grades that are telling us that they seriously considered suicide in the past 12 months. So this is a common issue that our students are facing. We have students reporting, 1 in 8 students reporting that they planned suicide. And as far as suicide attempts, this has been hovering, as you can see, around 1 in 10 students, which basically translates to about 2 or 3 students in any average sized class in a school. What we did see was a big drop in this most recent year. There's an asterisk there because the wording of the item changed. And so we can't know the extent to which that impacted responses. We hope that this is a promising trend of this decline, but can't 100% say that for sure. And then as far as students reporting some symptoms of depression, that's around 1 in 4 students. And I have seen, and if you're familiar with PAYS data in your county, you may have seen that these percentages can get much higher than that. So I have seen, I think, the highest around 44% of students, which is close to half of students reporting some of these symptoms. But on a promising note, if you compare 2023 data to 21 data, you do see that some of these percentages have come down from that 2021 year, which was like a pandemic year, if we want to think about it that way. So to move on to what our state has been doing, and Deputy Secretary Smith highlighted this at the beginning, but since 2019, we have been collaborating across state agencies as part of a suicide prevention task force at the state level. And this all started under the Wolf administration. And really the idea and goal here was to develop a statewide plan. And this plan was meant to be collaborative, and it did get pushed out in September of 2020. I'll talk about it a little bit, but currently our plan has kind of come to the end of its term. So I will share a little bit about what the state task force is working on now as we transition into developing a new plan. But our task force has overall been meeting monthly and on a regular basis to talk about suicide prevention across our agencies and consider various aspects of the plan and what implementation around some of our goals has been looking like. So this really launched an ongoing collaboration between state agencies to be elevating and continuing to talk about and prioritize suicide prevention. This is just a brief snapshot so you can see all of the agencies that have been participating. We've also had participation from several of the governor's affinity commissions. And I think just something to really point out here is that prior to this, suicide prevention efforts may have been happening across different agencies, but in general are really seen as the role and responsibility of our state mental health agency. And really that has mirrored how suicide prevention has looked in the behavioral health system as well. It's been seen as a responsibility of the behavioral health system. But that has really changed in recent years nationally, and this really shows that it's changed in Pennsylvania too, because all of these agencies are coming to the table to acknowledge their role and responsibility in suicide prevention in some way. These are the 8 goals that were part of the plan. I use past tense were, the plan has sort of ended, but we're in that transition point, as I mentioned. And these are just the general kind of categories of where the goals were. But the idea is that they represented a comprehensive approach to this public health problem, which is how we acknowledge suicide prevention. And we landed on these areas based on both listening sessions with the public. So back in 2019, we spent about 6 months traveling around and holding about 9 listening sessions with almost 1,000 individuals coming out to share about their experiences or expertise in suicide prevention. A lot of individuals with lived experience. We had youth come out, we had educators come out, we had clinicians, researchers, crisis responders. It was a very broad representation, and their feedback was integrated into the plan and kind of helped us to land on some of these goals. We also aligned our work with the national strategy at the time, which was from 2012. We have a new national strategy that just came out last year. But as this plan has unfolded over the past 4 years, there have been different agency initiatives happening across all of these different areas, as well as, and I'm sure you all can speak to this, and we love to hear more about this, but efforts in these areas happening widely at the local level. So we know that this is kind of at the state, and then we also envision that, you know, the state agencies would not be the sole, would not have the sole responsibility for necessarily carrying out these goals in full, but that all of those that are working tirelessly at the local level would also be kind of looking to the state plan as far as aligning their efforts. So we have had a lot of successes over these past 4 years, just in the sheer fact of coming together to collaborate around this shared plan and then staying in collaboration, as mentioned, on a monthly basis. But that communication and collaboration has been really wonderful. The opportunities to participate jointly in national learning opportunities, to form new work groups whose goals and mission span the work across different agencies, to collaborate on grant opportunities. There have been a lot of opportunities that have really come out of this work. In addition, our agencies have become aware in much more detail of the specific agency initiatives that are happening. As you know, work at the state level and national level, right, can be very siloed at times. So finding out about specific initiatives happening under the Department of Military and Veteran Affairs, under the Department of Agriculture, under the Department of Education, Department of Aging, et cetera. We also have had the opportunity to provide shared input into some other bigger projects. So for example, at a national level, our state gets surveyed along with every other state about our suicide prevention efforts, and it's part of a needs assessment, which we used to complete just as DHS and now have the opportunity to get cross-agency input so that our responses are much more reflective of the work that we are doing collectively. As mentioned before, this has really kept suicide prevention at a top tier as far as priority, and it's given us the opportunity to continue to come back to this issue and evolve our efforts through all of the things that I've been sharing. And then every September, with September being Suicide Prevention Month, we also have come together over the past few years to have sort of a cross-agency event and acknowledge the importance of suicide prevention, of course, in September, but really throughout the year. And I will share a little bit later a resource that we develop every year that can be helpful within your counties and all of your local partners. So something especially of interest to all of you here today is that we did survey local county suicide prevention task forces, and this did occur several years back. We had a slight delay in doing some analysis of that data, but, and this is something that it just speaks to the need to continue to gather data and gather more recent data, but to at least just share a snapshot of what this was, we wanted to ask our local county suicide prevention task force partners about their efforts around suicide prevention, what their task forces look like. We wanted to get a kind of a lay of the land as to how many task forces are out there operating, and also find out what those task forces are doing in alignment with the goals of the state plan at the time. And so the information we got back is basically that there are 33 task forces across 41 counties. And we know for a fact there were a couple of task forces that do exist that didn't respond to the survey, but just as a snapshot, that was what we found, that there was a wide range of how long these task forces had been in existence, with some being very new at the time to some having been in place for decades. And then they're pretty diverse in general. So most task forces, actually, I'm sorry, the average number of participants on these task forces is 16. So some of them are quite large, and we heard any number of participants. They're from the county, they're from schools, they're from provider agencies, they're from local hospitals, they're the coroner, they're from law enforcement. So really a varied representation of individuals that can come together and talk about suicide prevention specific to their counties. And so when we asked about the goals and the extent to which those counties were already involved in efforts around the goals in the state plan, we found that there's a lot of involvement and activities happening across a bunch of goals, but the most significant ones by far, all task forces felt like they had an important role in suicide prevention awareness efforts. And that, if you have a task force in your county and you're familiar with their work, you're probably nodding just because, it's anything from awareness events during Suicide Prevention Month to Out of the Darkness walks to other different community types of events. That was every task force. And then the vast majority of task forces also felt that they have a very strong role in pushing out suicide prevention training locally within their county. And many task forces talked about having trainers in different known trainings for suicide prevention that go out and offer trainings in different sectors. But then, of course, we did ask about needs, and there is certainly a need ongoing for additional training in broader topics related to suicide prevention, certainly resources to support their work, and opportunities for collaboration. That was something that we heard as a common need, as far as those task forces having a chance to come together and share with each other what they're doing, and also collaborate with us at a state level. So just before I transition into having Sarah and Dan talk about 988, we are in the process of updating our state plan. We've started gathering data from agencies on their accomplishments over the past 4 years and hearing about some of their priorities moving forward. We do want to streamline the plan so that it is more focused and a shorter term plan where we have the ability to really monitor some of the actions that are happening. But just as in the last one, we do want to align it with the national strategy. And as I mentioned, there is a more recent one that came out last year. And we really are encouraging agencies to highlight actions that are relevant to the specific populations that they serve. And many of our agencies do serve populations that are a group that's known to be at increased risk of suicide. So with that, I will turn it over to Sarah, I believe.
Yep. Thanks, Dr. Rosen. Very good to see that all in one place. Even though we meet frequently, it's good to see what's happening on the statewide level. One of the last things that Dr. Rosen mentioned was the national plan for suicide prevention that came out last year. And there was quite a bit of mention of 988 in that plan, because the previous iteration of the plan was before 988 launched, as is the case with our own statewide plan. So seems like an appropriate segue now to talk a little bit about 988 and our public awareness campaigns. I did have the pleasure of presenting to the County Commissioners Association probably 2 years ago now. I feel like the time goes so fast on our public awareness planning. And so hopefully this isn't too much of a repetition, but I'm going to be able to update you on what we're doing now as well. So our first public awareness campaign launched in November of 2023, and we used our in-house ad agency, which is called Commonwealth Media Services, or CMS, to develop the creative and reduce the spend. So it basically allows us to use funding that we received from SAMHSA, federal funding, to put out a campaign. We had a total budget of $550,000, and that campaign ran from November 23 through February of 2024. And our goals are really to raise awareness of 988, encourage its use, and reduce stigma associated with reaching out for help. So, you may recall that 988 launched in July of 2022. And at that time, SAMHSA had asked, well, by their own action of not putting out a big public awareness campaign that it was launching, but also had asked states to sort of lie low, if you will, simply because there was uncertainty as to how many calls were coming in. They didn't want to start to overwhelm what may have been, new call centers and states. So it was sort of a soft launch of 988 in July of 22, and then we really went into setting up our own campaign that, as you see, launched in November the following year. Well, we know that during that campaign period, our call centers experienced significant call volumes and did lead to a record high number of calls in January of 2024. We can't say it was absolutely tied to that, but we have a feeling it was certainly contributory. Next slide, please. So the media elements of that campaign included billboards and bus shelters, Facebook and other digital programmatic display, online ads that were targeted by age, gender, interest in topics, and geography, point of purchase at gas stations, so like the gas pump toppers, convenience store ads on payment screens, and other community engagement. And so we had approximately, with all of that, a total of 425 placements, and it generated more than 45 million impressions or views. And you see a couple examples of the messaging there, which really tried to, through the photographs, tie it to some of our more at-risk populations. Next slide. Oh, wow. Is that all I had to say? Sorry. So for some reason, I thought I was also talking about the next iteration of the campaign. So my error, sorry. I'm going to turn it over to Dan.
Thank you, Sarah. So I'm going to just walk through a little bit of the 988 data that we've collected past and present, just to sort of get a landscape of where we've been and where we're at with 988. So this first slide shows the annual volume of calls received from Pennsylvania to 988 since the launch in 2022. 2022 data is annualized, so a lot of you may know that 988 actually evolved out of the National Suicide Prevention Lifeline, or the 273 TALK number. So we took only the 988 specific data from the July launch forward and then annualized that to 2022. But as you can see here, there's about a 10 to 20% per year growth in the number of calls to 988 from Pennsylvania. Just a note on 2025 as well. So this isn't a forecast. This is just an annualization of the data that we have so far. Typically, we see an uptick in calls to 988 in the summer and early fall months. So that 2025 projection is probably the lowest, like the low end figure of what we will receive in 2025. Very likely to be higher. Next slide, please. So specific to the chat and text modality, Pennsylvania started doing in-state chat and text in November of 2023 with one provider. Previously, you could send a text or use the chat platform to 988 from Pennsylvania. But since there were no in-state providers previously, those would just go to a national provider. So once we started doing it in-state, we've seen an incredibly rapid growth in that modality, and it far outpaces the national growth rate, as you can see. National growth rate of 37 versus 179. So for some reason, I'm sure part of it due to the great work that our marketing and comms folks have done, but probably also for some reasons unknown, that modality has really grown in Pennsylvania. So that is certainly a large area of focus for us here at DHS in terms of ramping up our capacity to not only handle the volume that's coming in now, but to anticipate future growth, because, to present, it shows no signs of abating. Next slide, please. So I wanted to provide a snapshot of what a month of current data looks like, just to get a sense of the current landscape. And I won't go into great detail here on every metric, but on the left side are our voice metrics. And by all federal benchmarks, Pennsylvania is doing above and beyond in terms of voice metrics for 988. So really proud of the team and the call centers who do this great work and have gotten us to be essentially a national leader in terms of 988 voice. One kind of data quirk to point out here is the in-state answer rate is 91%, which is above the federal benchmark. But there's often a little bit of confusion in terms of what that means. So that doesn't necessarily mean that 9% of calls are rolling out to the national backup or going unanswered. Virtually no calls go unanswered. They're either answered in state or they go to a national backup. But the way that our federal partners present the data, that shows only the calls that are answered at the center level. So there's about 7% or so monthly that end up in a situation where the caller hangs up before the call center actually gets to answer. They're called abandoned calls, but they're basically hang up. So that's why I include the flow out rate here of 1.9%. That's actually the percentage of calls that our call centers are unable to take just due to capacity that then go out to the national backup. You can see on the chat and text side, as I mentioned, we're still really building up that modality. The other thing to point out here is the average talk time. This is really the challenge with chat and text in that those interactions take a lot longer. They take a lot more resources. So staffing up for chat and text is certainly more of a challenge, but our call centers, even though the in-state answer rate isn't where we want it to be, it is actually incredible considering the amount of capacity we have right now in staff to answer those chats and texts. Next slide, please. So I just wanted to also provide quick overview of where 988 calls are coming from. You can see here that it largely tracks population-wise, but there are certainly a few outliers where it's certainly not a direct correlation between population and utilization of 988. Next slide, please. It's just kind of showing that bottom half of the ladder, and wanted to point out kind of a quirk about county level data. So this is the note on geo-routing. Geo-routing essentially uses cell tower information, but not location specific, right? So it preserves some degree of anonymity by giving an approximate location of the caller. And what that does is allows the call to be routed to the call center that's closest geographically. Before March 4th, when AT&T finally got on board and implemented geo-routing, calls from county were essentially determined by the caller's area code and exchange. Obviously, a lot of people move. I certainly not lived in the town where I had my, where I got my cell phone service for about 20 years now, but I still have that, Lewistown 717 area code and exchange. So we really only recently had the capacity through the data that comes down through the feds to actually tell where our callers are physically located. So, this March data is really the first almost full month we have. There were a couple, AT&T calls that may have gotten routed based on phone number prior to March 4th, but this is a pretty good proxy for where our calls are coming from. Next slide, please. And then finally, I just wanted to present the routing map here just to give an idea without going into too much detail, kind of how our coverage is structured with those centers. You can see that broad swath of purple. Center for Community Resources, our largest 988 call center, handles a lot of the northern tier and a lot of the rural counties in the northern tier, western and central Pennsylvania. You can also see a couple single county centers, and then a couple like Penn State Holy Spirit handles the area of Dauphin, Cumberland, Perry, Adams, York. So we have a mix of centers in terms of coverage areas, and it's really been to our benefit because it's allowed us to be nimble. It's allowed us to cover outages, staffing shortages, incidents that come up with 988. We're really able to be flexible because we have a diverse set of call centers, both geographically and in terms of size and coverage. So next slide, please.
Okay, and I think it's back to me. So just before we kind of move into discussion and questions from all of you, I'm going to highlight a couple of our youth initiatives and then just share some of the resources that we've developed through grants or other projects that are available and that we would love for you to have access to and to share in your counties. But first, our youth suicide prevention work. So we have had several federal grants. In fact, we are currently working on our 5th grant from SAMHSA. These are called the Garrett Lee Smith Youth Suicide Prevention Grants, in case you've heard anybody talking about them in your counties. Our last one, which was our 4th round, was actually, we did a lot of work with about 15 counties. We also had a statewide resource development component and training component to that, but we did some in-depth work with about 15 counties, working with their county mental health leadership and their local task forces to pull together partners from various youth serving systems that youth interface with, youth and their families interface with during a crisis in some way. So whether it was schools or the crisis system or inpatient or outpatient or emergency departments. And we worked with counties to do a data collection and then a strategic planning process to create some goals and action items for youth suicide prevention, specifically focused on that cross systems collaboration to really try to support that improved continuity of care for those youth. And that was the focus of our last grant. Our current grant continues to build on that, but we now, as a lesson learned from that last grant, something that we heard time and time again through those meetings across those counties, is that we really needed to directly engage with youth and families. And because a lot of times those systems partners are not communicating effectively or at all, the burden does fall on youth and families that are already in crisis to be navigating those transitions between all of those systems, and that they really need to be at the table and they need more support when it comes to suicide prevention. So taking that as a lesson learned in this current grant, we are partnering with a number of youth and family focused organizations to really look at different resource development, pilot some different strategies. It's anything from tip sheets to podcasts to a wellness mobile, to looking at a telephone line for peer support for parents that have a child that is at risk of suicide. It's a whole range of different efforts that we're really pleased to be able to partner with some really amazing organizations to work on. And then in addition to that, we heard that there was a need to do some more in-depth training of treatment providers. So we're not working with 15 counties, we're scaling it down so we can do much more in-depth work with about 4 counties. And with those counties, we are providing training on evidence-based treatment, which is called CAMS, Collaborative Assessment and Management of Suicidality. It was developed by David Jobs, and we're working to train their providers with the hope that we can build capacity in the outpatient setting to be able to treat young people at risk of suicide in an environment that is more appropriate, less restrictive than a setting like inpatient when inpatient isn't needed. And sometimes that higher level of care is a default option because there are not other services available. And so we're looking at really kind of building out that capacity to have those services delivered when it's safe to do so within a community setting. And so doing that targeted work as well. Also, just another quick shout out to the image here. So this was the winning PSA poster image from this most recent year's contest that Prevent Suicide PA leads. And it's basically these 9 images of different students saying "you matter" in 9 different languages. It's really neat. And then we also had the opportunity to be invited by SAMHSA to their first ever Policy Institute on Black Youth Suicide Prevention. This took place 2 summers ago, and this was convened because of the significant concern over the increasing rates of suicide among Black youth. They saw a 37% increase in suicides in a very short time from 2018 to 2021. And so this was a big national initiative at that time, and 8 states were invited to participate in that, including Pennsylvania. So we had a pretty diverse team of individuals from different educational systems, state agencies, community settings, clinical settings, get to go, and we developed several goals and we're able to sustain that work over the past 2 years, growing that work group from about 8 people that went to this event to more than 30, and being able to really look at some of our goals and move those forward, including through conducting a series of convenings of Black youth and offering educational opportunities and some discussion opportunities to really start to gather information about their experiences and look at how we can use that and continue to engage those youth in these efforts moving forward. And so then I will just leave this slide up for a second. You will all have access to these slides, and these are different resources, some of which we've already mentioned here today. Another PSA there on as the image. But one thing I specifically want to mention is the 4th point there, the Pennsylvania Suicide Prevention Month Guide. We work with several organizations to create this guide every year, and we try to roll it out right before September, which is Suicide Prevention Month, but it has applicability all year round. It has a compilation of resources that are meant to be pulled out and used at the county level, at the community level, in the schools. Really, they're designed for any audience. And it's anything from sample social media posts about suicide and resources like 988 to a sample proclamation that can be used to declare Suicide Prevention Month, to a whole constellation of resources on all different topics related to suicide prevention. So that would be something that I would say to check out, even though that came out for the last September. The resources are very relevant, and of course, we will continue to work on those and push one out again before this September. So just a heads up about that. There's a link to the PSA contest that I mentioned. That's a statewide contest that you can, again, advertise broadly for youth to engage in. The Prevent Suicide PA Online Learning Center offers free trainings for lots of different populations, educators, mental health professionals, community members. And so with that, I will just leave our contact information here for a moment, and then I'll stop sharing and turn it back over to Brenda.
Thank you, Perry. As Perry said, we're going to be making the slides available to anybody who wants them, and we are taping the presentation today. Earlier this week, I was asked by Commissioner Ellis Marseglia to give her an opportunity to talk about some of the things that she's working on in Bucks County. So I'd like to call on her now.
That's really very nice of you. Thank you. I had just wanted to share a couple things we're doing, and also maybe just get some feedback from people on if you have any new ideas. We are really struggling with men over 55 with gunshot wounds or gunshot deaths. And so we have started giving out with gun permits, a 988 card with 3 symptoms listed on the back. So it's very simple. And we are about to start going out with police and detectives to local gun shops to try to convince them to hand out that card. The other thing, there was something else. Oh, we also just did a letter, and I thought it would be, I guess I thought it would get more play, but we mailed letters to churches, I guess, and synagogues and mosques. I think we sent 550, asking them to put some statistics in their bulletins, let people know that there's a 988 number, volunteer to do trainings at their churches. And we heard from a handful, was hoping we'd hear from a little bit more, but that seems to be something I'm concerned about right now. And the second thing is different ways, if anybody has any, to get the 988 number out a little bit more. I know we've had a couple train incidents lately, and we do have that number, but wasn't helpful in those situations. So just looking for some new ideas that way.
Thanks, Commissioner. Any of our panelists want to respond? Sarah, go ahead.
Hi, good questions. Thanks for those. Just a couple things we're doing. Well, I put in the chat a link to the 988 partner toolkit, or it's just called a toolkit, I think. So it's basically any and every piece of promotional materials you may be interested in. Everything's free. You can order what you want, certainly limited quantities. But there's a lot of great stuff on there in multiple languages and really for different audiences. So I would encourage everybody to take a look at that and, avail yourselves of some of that free information. Something else we're doing too, we put together a small work group from our folks that work on 988, Steve Ross is on, and he joins me in that group with a few other folks. And we are looking at ways to reach into the community to get to essentially what you were saying, Diane, right? So work out to like talk to faith leaders, like what can you do? We did a little bit of that with our paid public awareness campaign, like sort of small mini grants, if you will, to these community-based orgs, and got some really nice response. So we're wanting to do more of that. So we've come up with some of our own things. We've been talking to the Pennsylvania Library Association to get some information in libraries, which is obviously an opportunity, when people are in there, both to pick up something if they're checking out a book, or if they use a free computer to have some messaging on the screen. So we're working on that messaging. We're also going to be presenting to our PA Career Link offices. So we have, I don't know how many career links, I don't remember the number, but we're presenting to them. We couldn't get on their calendar until this summer, but the same type of an opportunity to share information. And, people come into the career links for all kinds of things, to practice job interviews, to get help on their resume. And sometimes there are people who are in a tough situation, right? They may be unemployed. So we're going to make information available and make those career link administrators just aware of what is available, as well as, again, with their computers, where a lot of people go on to job search and to do interview practice, having messaging on 988. And we're working on a few other things around that, to really kind of meet people where they are. And so, again, I think what you're doing is great, right? I mean, we're hopeful that when we did it with the paid media campaign, that we were able to do these micro grants, mini grants, whatever, that it was helpful. But I think our response with this small work group has not been to offer any money. It's just people are like, yes, we would love to help. So I don't think it necessarily requires funding, but really just to reach out.
So any counties have something that they would like to share, perhaps something that Commissioner in Bucks County and others might be interested in copying or attributing in their own county? Anybody? I see at least one of our county MHID administrators. Donna, anything that you wanted to share with the group?
I'm also from Bucks, so I thought Commissioner Marseglia did a great job in terms of, what is new that we are trying to do. We do have a very robust, I think, suicide prevention task force and have it, done a lot of awareness in terms of postings in parks where we were seeing trends at one time. The train issue, we've been really impacted by that this year, despite signs. So, we've been trying to research what could be better prevention, in terms of the train as a means. That seems to be, when we researched, it seems like other countries have tried to do more around physical barriers. But that, again, that's something that we would not easily be able to impact. But again, the trend that we're seeing too is in that older age group. So we're trying to connect with Area Agency on Aging and what can we do around that older age group, which, at one point was trending from like 65 and older, but now really is trending at like 55 and older. So I can say older since I'm in that age group now. But those are the particular trends. So we're not seeing the trend actually as much in youth as is seen nationally. But we have the other end. That said, Pennsylvania is also an older, by population, probably has more older individuals than maybe some other states.
I can say the same thing, Donna. I'm older, so I can say it too, but we definitely work with the area agencies on aging. We have a representative from there on our advocacy coalition. They've definitely availed themselves of a lot of the information from the toolkit that I linked to. And as well, they came up with some of their own trainings that now our call centers have that are more specific to the counseling or the the talking, chatting with older adults. So there's things going on along there, as well as consideration for future public awareness campaigns where we would emphasize older adults. I was sort of surprised to see that in some of our own data, that we saw 50 plus more calls into our call centers from that population. And you're right, we are an older population, but we're keenly aware of the need to do some things very specific for that population in terms of being at risk.
I see Perry placed some resources in the chat, as well as Sarah. So if you haven't taken a look at the chat recently, please go back there. Anyone else have something they would like to share? Questions, comments? Please go ahead, Jill.
I'm going to put a link in the chat. OMSAS is still in the process of building out our crisis certification that will be housed in the MyOMSAS platform, but some of the modules are already up, and one of them deals with crisis workers and how they can engage well with the older adult population. So that is a resource currently available if any of that is helpful to your staff, and I'll put the link in for you.
Can I jump in and add one more thing? I don't know
Please
if
do.
anybody else has this, but we are in the very, 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 very beginning stages of trying to put together loss teams. And I think Northampton County has them. Do you know any other counties that have loss teams?
Anyone? I'm not aware.
Okay.
I know that several counties are looking at that model. It is, one of the most established models for, and if you're not familiar with what that is, it basically is kind of like a rapid response team, so to speak, for when a suicide occurs. A team of individuals, including like a peer, right? Someone that has lived experience would go immediately to, the scene, essentially, to offer support, especially to the family, as early as possible. And it's this very structured model that was developed by Dr. Frank Campbell. And there is a lot of interest, that at least that I've heard through even our youth suicide prevention grant work, from a lot of counties. I know specifically, I don't know if someone from Lehigh is on, but I definitely know that they have been working on that model. So that would be a good outreach point to find out more and maybe how it's been going.
Yeah, we did connect with Lehigh, actually, but as you're saying that there are a number of counties that are showing some interest in it, I wonder if like some kind of learning collaborative might be a nice idea in terms of, organized by OMSAS.
That's a great
Or
idea.
at least sharing of who the interested counties are, and we could self-form. But I think that it's so helpful, to have that bigger think tank, because you only know what you know, and
Yeah,
might be
we can do
nice.
it virtually, so make it easy.
There are lots of ways that the model can actually look in practice, right? Like, it's a structured model, but it can look a lot of different ways. So I think that's a great point.
And I think, as I said, we met with Lehigh, and we know what the very structured model is, but, sometimes there's some practicalities, and, we're trying to do information gathering now, and where would it be okay to push the boundaries on the structured model, and where definitely not, just that group think, I think, is always helpful.
Other questions, comments? Anyone? All right. So I will give one last call. Anybody have anything to add before we close out today? So again, I want to thank our presenters today, Dan and Sarah and Perry. We really appreciate you spending the time so that we can talk through some of these things and for folks to gather additional information. Jill, thank you for sharing, and Steve, appreciate your joining. Our team here at DHS is available to you. If you need to connect with anybody after this call or at any time, you can always do that through me. Everybody, I think, probably knows how to get a hold of me by now. We also want to thank all of you for your partnership and your ongoing willingness to work with DHS. I remind myself every day that we at DHS do very little on the ground direct support for people We support you who support people, and we're glad to be able to do that, but we're also grateful for that partnership. I will send a link to the recording once it's ready, and we'll get the slides out to everybody. If anything comes up afterwards, another question or what have you, please let me know, and I'll be happy to filter that out. Last but not least, if you have ideas for other sessions that we could be adding to our brown bag series, please let me know. Anything that DHS does, we're happy to bring folks to you to have a discussion. And I'm going to give you back 7 minutes of your lunch, and hopefully you enjoy the rest of your day. Thank you all so much.
Thank you.
Everyone.
Thank you.
Bye-bye.